Welcome back to another episode of Vitals and Voices, where we bring clarity to the complexities of the American healthcare system. One story, one solution, one voice at a time. I'm your host, Dr. Folusho Ogunfiditimi. And I'm so excited about today's episode because I'm coming to you live from the floor of the American Academy of Physician Associates 2026 Conference and House of Delegates meeting. Since May 15th, thousands of physician associates, PAs, PA students, educators, healthcare executives, advocates, researchers, industry leaders, and healthcare innovators have gathered here in the great city of New Orleans, Louisiana, for one central purpose: to discuss the future of healthcare and the evolving role of the PA profession within it. And what has become clear throughout this conference is that the future of the PA profession is not being shaped by one single issue. It is being shaped by multiple interconnected conversations happening simultaneously. Conversations about advocacy, workforce sustainability, leadership, education, technology, governance, diversity, burnout, and ultimately patient care. So as I sit here reflecting on the profession's identity and advocacy, one of the strongest themes throughout the House of Delegates has been advocacy. Not simply advocacy for the PA profession itself, but advocacy for patients, for communities, for the practices and the healthcare systems that rely on PAs every single day. There have been a robust discussions surrounding the future direction of the academy, governance issues, workforce development, and the role PAs continue to play in improving healthcare access throughout the United States. There have also been extremely meaningful conversations surrounding diversity, equity, and inclusion, not merely as a terminology, but as professional values that influence how we care for patients, how we support one another, and how we ensure the profession remains inclusive and representative of the communities we serve. At its core, many of these discussions are really asking an important question. What kind of profession do we want to become over the next decade? And that leads me into the next main theme that was discussed during this conference so far is just the thought about how the longitudinal career of the PA workforce will develop and how is that facilitated. In many ways, delegates have discussed supporting the PA profession from cradle to grave, meaning how do we engage students earlier? How do we mentor and retain early career PAs? How do we prevent provider burnout? How do we create healthier work environments? And how do we ensure experienced PAs have pathways into leadership, governance, policy, healthcare administration, and executive decision making? These conversations are incredibly important because workforce sustainability is no longer just an HR issue. It's now a national healthcare access issue. And if we fail to support healthcare professionals across the entirety of their careers, we risk worsening burnout, workforce shortages, and reduced patient access nationwide. One of the most impactful presentations at this conference was at one of their main stage events. And this came from a behavioral scientist, Jason Dorsey, who delivered an outstanding keynote on the multiple generations currently working in healthcare today. From Generation Z to baby boomers, he discussed how every generation enters healthcare with different experiences, different expectations, different communication styles, and different perspectives. And perhaps, probably the most important thing he highlighted was the understanding of these generational differences is not simply a leadership skill. It is an increasingly becoming a clinical competency requirement. As healthcare providers, our ability to understand generational perspectives can directly influence communication, trust, patient engagement, team dynamics, and ultimately healthcare outcomes. For PAs specifically, this insight is especially valuable because we often function at the center of interdisciplinary team based care models. We communicate across generations constantly with patients, nurses, physicians, administrators, students, and healthcare leaders. Understanding those differences helps us become better clinicians, better communicators, and better leaders. And that's one of the values that has been highlighted at the conference so far. But what also stands out about this conference is the diversity of people gathered here. This is not simply a conference for practice in PAs. This is a gathering for PA students, for pre-PA students, educators, researchers, healthcare administrators, executives, and clinical leaders and industry innovators. For example, the exhibit halls are filled with emerging technologies, pharmaceutical innovations, clinical advancement, AI-driven healthcare tools, and educational resources that continue to shape modern healthcare delivery. But beyond the technology and education, conferences like this create something equally important. They create connection. They facilitate collaboration. They establish mentorship and professional inspiration. For students, this may be their first exposure to the scale and influence of the PA profession. For experienced clinicians, it becomes an opportunity to reconnect with the mission and future direction of healthcare. And for healthcare leaders such as myself and industry partners, it provides an opportunity to better understand the growing importance and advancement and availability of PAs as part of the solution to America's healthcare challenges. So, as I wrap up, as this conference continues through Tuesday, May 19th, one thing remains very clear to me. The PA profession continues to evolve, not only clinically, but educationally, organizationally, politically, and strategically within the broader American healthcare system. And if there's one central takeaway from these conversations at AAPA 2026, it is this. The future of healthcare will require adaptable, collaborative, patient centered leaders who understand workforce sustainability, technology, communication, advocacy, and human connection. And PAs are uniquely positioned to help lead that future. Thank you for joining me for this special live reflections edition of Vitals and Voices. I'm your host, Dr. Folusho Ogunfiditimi. And until next time, continue leading, continue learning, and continue elevating the conversations that shape healthcare in America. Thank you.